The Kardashians are amongst the most famous people known to eat their own placenta postpartum. Let's talk about placentophagy, placenta eating. This video will cover what placentophagy is, the process, risks involved, current research, and an expert opinion. Let us get started by getting a better understanding of what placentophagy is and its various aspects. So what exactly is a placenta? A placenta consists of tissues that are connected to the mother's uterus through the umbilical cord. Its main purpose is to provide nutrients and ensure the supply of oxygen to the fetus. It also carries out waste and toxin removal from the body. Placentophagy is the consumption of the placenta after birth. There are multiple forms through which the placenta can be ingested. This ranges from capsules, raw form, liquid, extracts, and smoothies. There are multiple reasons that encourage placenta eating. This includes gaining nutrition, improving energy, encouraging milk supply, and improving mood through mitigating postnatal depression. The placenta is a natural source of hormones, elements, and amino acids, particularly hemoglobin and other globins, cortisone, placental opioid enhancing factors, HPL, and prolactin for milk production, interferons, and prostaglandins for immune defense. The emergence of placentophagy started in the 1970s and was encouraged by Chinese midwives. However, it has always been a part of parturition in mammals. Further in the timeline, various methods of placenta ingestion can be seen. This includes dehydration as observed in this image. Currently, there's a gap in the understanding of the benefits and even the risks of underlying placentophagy. This is still an area under research, specifically with the peak that is occurring in this practice. So how exactly does placentophagy commonly occur? As mentioned before, placentophagy can be conducted in various ways such as ingestion raw, cooked, or via pills. The most common process is encapsulation that involves creating encapsulated placenta pills. It starts by collecting the placenta or freezing it, then steaming it, dehydrating it, and pulverizing it into a fine powder in order to encapsulate it into gelatin capsules. It is now ready for consumption. Now you may wonder, what are the risks involved in placentophagy? As with anything, risks exist. Although placentophagy is highly experimental, some repercussions and risks can be noted through study trials. For one, the process of placentophagy must be done according to precise methodology to preserve the beneficial elements. It must be noted that analgesic effects by placental opioid enhancing factor, also known as POEF, is lost when the placenta is kept at room temperature. This may also lead to increased risk of contamination by lead, arsenic, cadmium, and mercury, leading to poisoning of the mother. The preparation process can lead to high risk of contamination, leading to a risk of infection of HIV, hepatitis A, Zika, or Streptococcus type B. A researched risk of placentophagy is thromboembolism, formation of blood clots due to exogenous exposure to estrogen in the placenta. Other theoretical risks also include the potential to trigger alloimmunization. Alloimmunization refers to the response to foreign antigens introduced to the body. The basis is that T cells of parental alloantigens are recognized, causing alloimmunization. Finally, a highly speculated risk with placentophagy is vaginal bleeding due to the exposure to exogenous estrogens. This is extremely rare. Although the risks and benefits are still being researched, it is the healthcare provider's duty to inform the patient about placentophagy, as it could affect their health and ability to conceive a child in the future. Now this raises a question. What kind of individuals participate in placentophagy? Let's have a look at current research. A recent research paper published in 2019 in the Journal of Obstetric, Gynecologic, and Neonatal Nursing, titled Understanding Placentophagy, studied Canadian and American participants. Their objective was to evaluate the knowledge, attitudes, and beliefs of women during pregnancy and postpartum regarding placentophagy. This studied women who had given birth in the last 12 months and found that the three key factors of participation in placentophagy were people with less education or high school diplomas, mothers who had given birth to at least one other child, and lastly, births with no complications. The survey also asked individuals the reasons for placenta consumption or non-consumption. The most common reasons for consumption were, quote, I heard/read about it and wanted to try it, and, quote, I believed the proposed benefits outweighed the potential risk. The most common reasons for non-consumption, on the other hand, included, quote, I believed the potential risks outweighed the proposed benefits, and, quote, the idea of eating my placenta was unappetizing to me. To summarize the main findings of the study, it can be said that 24.9% respondents consumed their own placenta in the survey. Those who experienced pregnancy-related complications were more likely to consume their placenta, and respondents were generally motivated by unproven benefits. This study did have its limitations, which included selection bias due to participants' requirement for internet access and social media involvement when completing the survey. Convenience sampling was used, which may have overestimated the number of women who consumed their placenta. However, it helped understand the beliefs of these women while accurately representing non-consumers. The study did not explore the correlation between placentophagy and maternal complications. I would now like to invite Dr. Elizabeth Cates from McMaster University to shed more insight on this topic.
Hi, my name is Liz Cates, and I am an assistant professor in the Department of Pathology and Molecular Medicine here at McMaster. I'm also an instructor in the Bachelor of Health Sciences program as well as in the Midwifery Education program. I am a registered midwife here in Ontario, and I registered with the College of Midwives in Ontario in 2015. While I am not actively practicing at the moment, that means I'm not actively seeing patients at the moment, I am affiliated with a practice in North Toronto.
What are your thoughts on this practice?
So I think a placentophagy is a really interesting topic. When I think about it, the first question that often comes to mind for me is why? Almost all other mammals eat their placentas, and humans don't. So why did we stop? I am not an evolutionary biologist. I'm not an anthropologist. So I don't know the answer to that question. Maybe you've found some of the information around the answer to that question in your research. But I think that if we did have more of an understanding of why humans stopped eating their placenta, it might provide us with some insight as to the advisability of doing it now. Is there a good evolutionarily reason to not eat placenta, humans to not eat their placenta? I can't think of one, but it is an interesting thing to think about. The next question that comes to mind for me is why now? You in your earlier part of your presentation, you point to celebrity culture as a driving force. And that does seem to be my experience here in Ontario of why some people are starting to think more about eating placenta after they deliver their baby. But then why is that a reason? Is that the only reason that people are interested in placentophagy? Is there other research that supports the benefits of placentophagy, or is celebrity culture enough to drive it for these patients? In terms of research, as you have no doubt seen, there is not a lot of support for the intended benefits of this practice. So why are people interested in it?
Reproductive research is generally understudied and overstigmatized. What can be done to solve this?
I would like to think that this is changing, and I'm hopeful that it's changing. But you're right in that reproductive health does seem to meet at this fraught crossroads of, women's health, which has historically been marginalized for a number of societal reasons, and pregnancy, which is surrounded by a lot of fear. I think potential solutions lie in people who are, one, forging ahead with this kind of work already and really pushing this agenda forward, and then people like you. So students like you are the future and can continue to push forward with research questions in reproductive health, work in reproductive health, so that birthing people and their families have all of the best information available to them, and then they can make good choices, and that will really improve their option and their well-being for years to come. So thank you.
Have you come across any patients wanting the service?
I have come across patients who are interested in this service. Not commonly, but I do have clients who ask about the practice of placentophagy, and then who do go on to ask us to facilitate this practice for them in a variety of ways, either helping them find a practitioner who performs placental encapsulation, or by ensuring that they have access to their own placenta after the birth of their baby so that they can prepare it or consume it if they wish to do so in their homes in the early postpartum. One of my roles as a midwife is to spend time to offer informed choice to all of my clients. So what that means is that my job involves a lot of education. So when a client comes to me asking about something, like whether or not they should eat their placenta in the postpartum, I need to understand why that is of interest to them and educate them around the risks and benefits of achieving their goals. So in my experience, the most common reason that clients have disclosed to me for wanting to engage in placentophagy in the postpartum is to either help them make more milk so they can breast or body feed their baby, or to help with their mood and hopefully avoid postpartum depression if that's a concern for them. Now, in both of these cases, their understanding of the process is that there are hormones in the placenta that will help them to meet these goals, either one or both of them. Fewer people are interested in the hypothesized benefits of things like increased iron that they could get from the placenta after the blood loss of delivery. And interestingly, iron is one of the few things that there is some evidence that survives the preparation process. When you, for example, cook or encapsulate a placenta. But if we go back and if we use the example of someone who's interested in placentophagy for, let's say, milk production, my role is then to walk them through the potential risks and benefits of the process. So in terms of benefits, there are currently no scientifically proven benefits for eating placenta when it comes to milk production. And this makes sense because the hormones that the patients are hoping that will help them, one, they have to act at the level of the brain, and two, these are proteins. These particular hormones are protein hormones, and they're destroyed through the process of cooking or steaming and dehydrating. And even if they weren't, they would be destroyed through the digestive process when you eat the placenta. So it kind of makes sense that we haven't seen any proven benefit in this way for eating placenta for milk production. In terms of risks, there are some potential risks. They can be somewhat mitigated with care. You've talked already about the case that was reported by the CDC of the baby who contracted late onset GBS disease after their parent consumed placental capsules. Now, in that particular case that the CDC reported, it's not entirely clear whether it was the handling or the consumption of the capsules. They were contaminated. It's not entirely sure where the GBS came from. The current screening methods for Group B streptococcus or GBS colonization in pregnancy are not perfect. And the providers of placental encapsulation are not regulated or required to be licensed. So in my experience of practicing in Toronto, many of these placental encapsulators are community birth workers, and they learn the practice and then they perform it in their home kitchens. So in terms of cleanliness, safety practices, there's not a lot of checks and balances in that area around placental encapsulation. Therefore, for these clients who are interested in this, it's really hard for them to know what they're getting. We can always do, as healthcare providers, our best to screen the patient, monitor them for infection, and then they can decide what the level of risk is that they want to engage in based on their trust in their encapsulator if they decide to go that route. And then there's also the financial piece. So for those choosing encapsulation, it's a service that they need to pay for with no known benefit. So that too is their choice.
So we would continue to discuss these risks and benefits, and they might change throughout the pregnancy, the labor and birth process. So as we come to learn the patient's GPS status, or if they develop an infection during labor. And then after all of that, it's my role to support the client's choice, regardless of what it is.
In conclusion, placentophagy is a personal choice that has gained popularity among some new mothers. While there is limited scientific evidence to support its benefits, the practice is not without risks. It is essential to make informed decisions about placentophagy by consulting with healthcare providers and conducting thorough research to understand its potential effects on maternal health. More research and awareness is needed to better understand the potential benefits and risks.